Thank you for your presentation. My first question is around better understanding of the reduction of the budget down almost, it looks like 25% or 30% reduction in your budget. Can you explain further the benefits of that, why that is aiding your organisation? Hello, you're on mute.
I think he's translating at the moment.
As we understand it, so you mean why we are reducing the target is not the budget. So
yes, why are you reducing the target? What value does that have to your organization? So
based on our performance measurement, we recognize that the old target wasn't let's say more realistic. So we collecting data and reach the point that reducing the target, it will be more reliable or more let's say
yes, if you please,
yes.
I can add here that according to new criteria that we have got from the performance reports from the head of the Department of Performance, our board could modify the revenue of Zamzam charity, which was in the past years beyond the capacity of our staff. So sometimes we need to encourage them when we give them realistic targets, and that's helped them last year, and we hope to help them more in this year, 2023, to be more encouraged to get to the target in I mean scientific way on the criteria. That's all. Okay.
So you've created a more conservative target for the staff to achieve versus a aspirational target. Would that be a way of considering this?
Maybe because we changed the criteria first, according to the reports. So we aspire to more and more, but we found that our staff, according to the 2020 and 2019, they cannot reach that target. So we have the criteria to increase about 10% every year. 10% of the revenue to be increased every year, and that what happened last year, and we could manage in 2022 to nearly reach the new target that is according to the capacity of the staff of Zamzam. Is it clear or?
I think you're answering my question in an indirect way, but I am taking the inference from it. So my other question for you was, has the introduction of this balanced scorecard approach made a stronger connection between your vision and your mission? And has that resulted in more or less meetings within your organization?
Can you explain the question in a different way?
By putting this new system in place, did it generate more meetings? In other words, more time spent discussing progress, or did it generate more action instead of meeting? So you are better aligned to reach the mission. So simply, did you do more or less meetings as a result of putting this system in place?
Yeah, we can't say it's less or more, but we have regular meeting. That's a monthly meeting, and every quarter quarterly meeting, and annual meeting. That's mentioned in the presentation in the beginning. So this is let's say set meetings and required meeting to just to follow up, reviewing the performance, reviewing the operational performance and strategic performance. So we cannot say it's less or more, but at least it's required meeting. Everyone knows that this meeting is required. We have to conduct, and we review the performance during such meetings. But in general, it's not wasting time. It is effective meeting. So it's part of our strategy and performance review.
I think what I've understood is you're a non-profit and you're helping needy people get access to healthcare, especially around the holy cities. Am I correct? Is my understanding correct? You're a non-profit helping.
Yeah, it's correct. It's a
Yeah.
non-profit.
Sure. Yeah. So I want to know, strategically thinking, have you looked at, first of all, great job by you, especially the context that you're a non-profit, you're into voluntary health support, etc. But since you're specifically around the periphery of the holy cities, I want to know, do you have any lead indicators in your strategic thinking on, help for pilgrims, not necessarily who are Saudi residents, but pilgrims who have come, let's say, for a Hajj or for Umrah, and they suddenly need medical assistance. So do you have that in your scope? A. B. Do you have any other futuristic measures rather than reactive measures, like, how many people you help, what kind of health grants did you give them? Do you have any futuristic measures? Like, for example, yes, no, and you can build on that. Are you doing things to educate pilgrims who are coming for the pilgrimage on how they can look after their health when they're in the holy cities? So that way the pressure on you is lesser. Are you doing something for healthcare education? So 2 questions. Number 1, how's your response time for pilgrims who are not Saudi residents? Do you help them? If yes, any evidence on that would be helpful. Is my question clear, brothers? We can't hear you. You're mute.
No, well, they're discussing it until
Okay.
and they'll come
Okay.
back.
Okay.
Patience.
I know. But I'm thinking about a patient who won't have patient. He'll need healthcare support immediately.
Yeah, I will answer your question, let's say step by step, okay? First, you mentioned our service is provided to Saudi and non-Saudi. This is in general. So we provide for patient first, and we have one strategic indicator that related to health awareness. So we provide health awareness for, let's say, for needy people or for, let's say, non-needy people, okay? So either for Hajj or at, let's say, regular time during the year. So now, you might know, we passed the Hajj time in the Islamic calendar. So we have participate in Mecca. We participate in all the entrance to Mecca, providing the health awareness. You mentioned in the last point of your question about the response time, we are not providing emergency service. So emergency service is part of the health ministry, but at least we have one initiative in the Holy Mosque in Mecca, that's in Tawaf. We respond to emergency cases in specific area in the Holy Mosque in Mecca. So this is just one initiative we provide in a specific time, in a specific case, but in general, we have 2 indicators providing the service for needy people, and we provide health awareness for all type of people, either Saudi or non-Saudi, all the time. I hope I answered your question.
Shukran, shukran jazeelan.
Could I add some words here? Regarding to Saudis and non-Saudis, Zamzam Charity serves and support Saudis. Perhaps the percent of non-Saudis about 80% and 20% Saudis. Why? Because we know that we are in Mecca, we have some communities from Yemen, from Syria, refugees, and also from Burma. We have from Bangladesh, India. Those are in Mecca region, Muslims or non-Muslims, the same. So we have the most of our beneficiaries are non-Saudis. The second thing that I want to say that we have indicators, we have also some indicators regarding to our response to crisis in Hajj, you see, and pilgrimage. You know that the last years, past years, we faced some crisis and Hajj because of crowded people around Haram and also in the religious issues there. That's what I wanted to add here.